you want your intensive care now or later? Welcome to the Eat Plants, Feel Whole podcast, a program designed to help you harness the healing power of plants and to transform your health. I'm your host, Todd Chobatar. I serve as publisher and editor-in-chief at Advent Health Press. And today we're talking with lifestyle medicine specialist, Dr. George Guthrie, about his book, Eat Plants, Feel Whole. Welcome, Dr. Guthrie.
It's a pleasure to be here.
Intensive care, not always something that we get excited hearing about. In this opening question, I asked, do you want your intensive care now or later? That's a question I learned from you in working on this book. Why do you find that question an important one?
I enjoy that phrase. It was part of our marketing pitch when I worked in an inpatient lifestyle program, trying to get people to come in. And you know, people have chronic diseases that are serious. Absolutely. You can have a heart attack and end up in the intensive care. You can get pneumonia. You can have a motor vehicle accident, right? But many of our serious diseases, like heart attacks and others, are actually amenable to lifestyle treatment. And if you change your lifestyle, you may actually be able to avoid going into the intensive care unit. So if we consider intensive lifestyle treatment as an alternative, it's either you get your intensive care now or you get your intensive care later. And I think it speaks volumes of the kind of the emotions that go in. It's really a choice to do something about it now rather than later. You know, it's been quite an experience writing this book. I've enjoyed the process, but if it's just a book full of information, it's not really doing as much as we would like. We would like to have people's lives change. In order to do that, the last section of the book tries to lead people through the steps to actually do something.
And that part, that transformative process, we've called it in the book, or you've called it, 18 days to transform your health.
Yeah.
And so 18 days, that's not all that long to be able to start seeing some real results, right?
It's amazing how much will change in the physiology. In just 2 or 3 days, one can see incredible changes in physiology and improvement. Now, you're probably not going to lose that much weight, but it's not really what you look like. It's what the physiology is on the inside. So by moving towards kind of a healthy alternative. I like to use this word induction, right? If someone is really sick and they need to change quickly, if we can do something a little bit dramatic, intensive care, to bring them more quickly into this sense of health, that would be a good thing, right?
It would be a good thing.
If someone comes with cancer, often the cancer doctors will talk about an induction phase. They give the heavy and difficult chemotherapy at first and then back off to the lighter once the cancer has been given really a knockout. So if you've got really bad physiology from diabetes and hypertension and whatever else is going on, the cholesterol in your blood, why not give it an induction phase, an intensive lifestyle intervention, so you can change that around quickly? So we try to make that available. I know not everybody's going to want to do it, but at least those who want to, who have the will to do it, can make that kind of dramatic, intensive change.
It's one of the things that I appreciated about the program when I first saw it is that you have these 3 parts to the program.
That's right.
And this first part you mentioned is called the induction
phase.
And the second part, just for reference, is what?
Therapeutic.
The therapeutic
that we need
phase.
to continue. We've got the body going in the right direction. We need to continue the therapy. Doesn't have to be quite as intense.
And then the third and final phase you would call the
maintenance.
The maintenance phase.
That is, okay, once we've gotten where we need to be and the healing has taken place, you certainly don't want to go back to the way you were living before, because if you keep doing what you're doing, you'll keep getting what you got, right? So to live healthfully would be a maintenance phase. And you can relax on some of the things, certainly related to induction or therapeutic. The maintenance allows a little more, but it's still an overall healthy lifestyle.
So take me back. Let's unpack each of these three stages a little bit more to give a better idea about what to expect in each of these three phases of the 18-day program. So stage 1, the induction phase. You've given us this.
Generally about 3 days.
About 3 days.
When I worked in the past in an intensive inpatient setting where I had a lot of control, I would put people on a 3-day fast so they weren't taking any calories in. Lots of water, fiber. Yes, they still need to take their pills, but we weren't giving them food. And it was amazing to see what happened. Really miraculous. Blood sugars coming down to normal, people coming off insulin. That's a marvelous tool, but I don't recommend it unless you got a doctor who's actually helping you with that, because there's a lot of things that can go wrong without that kind of maintenance, that monitoring. But we've kind of given a second best alternative to that, and that is, for lack of maybe a better term, flower leaf stem. Okay,
flower leaf stem.
So we're going to use above ground vegetables that are easily digested, that are very low in fat, high in water, high in fiber, nutrients that our bodies have been missing if we've been eating the average American diet that causes the average American illnesses, right? So we've been low in fiber, low in potassium, low in magnesium. So as we take those kind of plants that are so high in these good things, the physiology begins to change. Because it's filling us up, we're not feeling hungry all the time, but the calories that are coming in are not clogging up the system. They're allowing the body to rest. When you sleep at night, your body's actually going into the fasting state, and you're gaining those benefits. So that's kind of what the induction is. 3 days worth of pretty much just vegetables. And fixed in ways. There's some great recipes in here which are appreciated, salads and whatnot that taste better than you might believe possible, okay? To kind of help through those days for that intensive induction phase.
So that's the first part. And so then the next part is really the next 15 days that 18-day program.
Correct.
And that phase is the therapeutic phase.
That's correct.
So tell us about that 15-day
period.
period.
Well, the focus is on whole plants, minimally processed, and still trying to keep the free oils out, because we're too much oil concentrates the calories. So we'd rather have only the oils that are already in the plants to kind of minimize those for the rest of those those last 15 days. Now, to be fair, people can go directly to that. They don't have to do the first 3 days. There's still benefit if those first 3 days are a little bit scary, worried about insulin changes and blood sugar change. You can still kind of gain benefit without doing that induction phase.
And in fact, in that 18-day program that's in the book, you actually give menu options and recipe options, whether you choose to do that induction phase or choose not to do that induction phase.
That is correct.
So like that. So you're giving us choice really from the beginning. But the preferred method is to start off.
For some people, it'll be preferred. I'm not trying to tell anybody they have to do it, but some people are in a state of emergency. They need to do something now. They need intensive care. So they have the 18-day program, and they have the real push, that kind of initial admit to the intensive care unit where they get 3 days of intensive.
So after the second stage, the 15 days, then we would move on to the maintenance phase.
Right.
So tell me about that.
You don't live in the intensive care unit, right? We've got to get back to life. And as we do that, there's a little more fat that is allowed kind of back in. You're looking for a long-term pattern that's healthy, that you can live with for a long period of time. So that's the hope, is to help people move to a healthier place and to gain the maximum benefit or improvement in their health in the reasonably fast period of time.
Now, I'm wondering if I went through that 18-day program and found that I was experiencing some real beneficial changes. I liked the way I felt. I liked the way that my body was going. Any problem if I wanted to go back and do that 18 days all over again?
No, I think that would be a good idea. I mean, if you got the improvement and you haven't reached really your goals yet, it's okay to go back and do that 18 days over again. Now, I don't know that I would repeat the 3 initial days again, although you could without any problem. You can just continue that 18 for kind of the next 18 to give yourself even more of a head start on a healthy living and to get further away from the disease.
Right. Now, with the maintenance phase that's on there, tell me about the long-term benefits of this maintenance phase. Again, it's focused on whole food, plant-based diet. And if I were to follow on this maintenance phase for a longer period of time, what are some of the benefits that I'm going to see from that?
If you keep doing what you're doing, you're going to keep getting what you got. So as the healing comes with the choice of a healthier diet and lifestyle, that healing continues over time. So the benefits physiologically that I've heard from people who have made these changes, blood sugars come down, they tend to come off of medications. Acid reflux disease tends to get better. Sometimes people come off those medications. Another one I heard recently, someone told me, you know what I noticed? My joint pains went away. And, usually that's not talked about a lot, but there is a connection between our diet, our lifestyle, our hydration, the plants we eat, the anti-inflammatory things that are in plants. The joints can feel a whole lot better.
That's wonderful.
So symptoms tend to disappear and we move towards health.
Now, in the book, you give a number of examples. In fact, really every chapter starts off with a patient story that goes through and gives an example of patients that you've worked with. I'm wondering, though, since this book has come out, or the original manuscript came out, have you had anyone going through the material as it is directly put out in this book and seen benefits?
That's really the pleasure of writing the book. I mean, it was hard work writing the book, and the hope is that people's lives would actually change. So there's kind of an interesting story that's a little close to home, we might say. So I work in a practice with about 50 physicians. Our head nurse has a family, as she explained it to me, that is a little on the heavier side, and she struggled to kind of keep her weight down, cholesterol heading up and whatnot. Her sister lives up in the Northeast and was having some significant health problems, low energy, just weight gain. She couldn't stop it. And she talks to my nurse, her sister, and says, I found this book that's really been helping me. And, I've got energy, I'm following the recipes, and it's really doing good. So they talk about this for several weeks. And finally, my nurse says, well, what's the name of the book? And she says, it's Eat Plants, Feel Whole. I found it on Amazon. And, of course, my nurse says, no, wait a minute, that really sounds like where we work.
Yeah.
Who's the author? Well, she says, that's my Dr. Guthrie. And her sister says, no, that's my Dr. Guthrie. So it's been kind of exciting to see, the life change of the sister. And, of course, my nurse also has some health problems, some cholesterol issues, right? And so she says, I'm going to do this along with my sister. So I promised everybody in the office, I said, if you'll read the book, I'll give you a copy, okay? So I gave her a copy. She's promised to read it, and she did it. So it's been, a couple of months now since she started that. At the beginning, she knew what her cholesterol numbers were. When she got to the end, not only had she lost weight and felt good about that, but her LDL, or bad cholesterol, had dropped from about 217 in that range down to around, I think it was 87, 88.
Oh,
so
great.
Her cardiologist, when she visited him with those numbers, said, this is very good. What did you do? And, of course, he was happy about it, and he said, we're going to cut your cholesterol medicine in half, and if you keep this up next time, we may be able to stop it. You should have seen her grinning from ear to ear. And then she said, I got a check from the insurance company for $800.
Really?
Oh, when she brought her numbers down and improved the parameters, the insurance company was rewarding people who did the right thing with their physiology.
Yeah.
So she was kind of happy about that too. Just in time for Christmas.
Just in time for Christmas. I like that. You know, it's great to be able to see people's lives transformed and changed when they go through and adopt these principles that you're talking about in the book.
It's a great pleasure. It's a great pleasure of my life to see people's lives change for the better and their diseases go away. Mm-hmm.
You know, among all of the important information that's communicated in here, Dr. Guthrie, I think where the kind of the rubber meets the road, so to speak, is the food that people are eating themselves. After all, name of the book, Eat Plants, Feel Whole. And I love the recipes that are included in the book. So you have 50 different whole food, plant-based recipes that are featured in the book.
With menus.
With menus, that's right, so that folks can go through. Actually, with this 18-day plan, there is a recommended menu utilizing the recipes that are available there in the book. But if someone wanted to just try some of those recipes out, there's also a free option that is available if folks want to go to eatplantsfeelwhole.com. It's one of the things that's actually mentioned in the bonus section in the back of the book. There are additional free recipes that are not included in the book, but additional ones that are available as a free download if folks go to eatplantsfeelwhole.com.
Now, let me reassure people, okay? These are not my recipes that I made up. I'm not a cook, okay? But we have brought together some of the best that we could find that's easy, tasty, quick, and healthy all together. And people who have tried those, including the nurse mentioned earlier, said, excellent food. She has really enjoyed it.
Every aspect of it. That is wonderful to hear. Dr. Guthrie, thank you so much for not only talking with us today, but for taking the time to write this book, Eat Plants, Feel Whole. I know it was a labor of love with high hopes that it's going to transform many people's lives.
Exactly. Thank you for the opportunity to share with you and your listeners.
It's such a pleasure. You've been listening to the Eat Plants, Feel Whole podcast, a limited edition 15-part series that's intended to help you harness the healing power of plants and to transform your health. I've been your host, Todd Chobatar. If you would like to find out more about the resources that have been mentioned in today's podcast, you can find links in our show notes. And in addition to that, you can go to eatplantsfeelwhole.com, where you'll be able to access many of the free resources that have been mentioned, as well as finding out more about Dr. Guthrie and his groundbreaking work. And if you'd like to discover other great resources that can help you to feel whole in mind, body, and spirit, visit us at adventhealthpress.com. And while you're there, sign up for our free newsletter where you'll receive health tips, some leadership wisdom, as well as some other free resources that we offer. Thank you for joining us for this podcast series. We hope that it helps to transform your health and the lives of many others that you'll share the information with.